You want answers? I think I'm entitled. You want answers? I want the truth. You can't handle the truth.
We are the Mad Men of Masculinity.
Your home for healthy masculinity. We're just real men having real conversations for you.
Hey. See?
Mm-hmm.
We ready.
We ready.
I know we're ready.
We ready. We in here.
Are we ready?
We like, see you. We coming. We coming.
Prime
I
time.
hope they don't have that trademark or whatever. I might owe them some money. Hey, ladies and gentlemen, I am Kirk M. Samuels.
And I am Jason B. Kendrick.
And we are the Mad Men of Masculinity.
That's right. We're just real men having real conversations for you.
For you. Yeah, this is your home for healthy masculinity. Right. You know what I'm saying? We're all about uplifting the manhood, the manosphere, the Mad Men mob, the Mad Men mafia. We believe that when men are healthier, the world is healthier. Men are like the tide, and when the tide comes in, all boats rise.
That's right. And today, talking about men's health, talking about making men healthier, we have a special guest in here with us. So, you know how we said we were going to bring experts in?
Oh, yeah.
We got a real expert in here.
Because when we talk about like healthy masculinity, a lot of times we talk about things around like mental health, emotional health. Not too long talking about financial health. We were talking about, fashion, your fashionable health. Now we're literally talking about your health.
Physical
we're talking
health.
About your body.
Yes.
We're talking about the body. The one thing you get that is hard to recycle. You know what I'm saying? I can buy me another suit, but it's hard to give me another one of these.
Yeah, you need a new suit.
So we got a guy. we got like a guy with some initials in the house.
He does.
You know what I'm saying? We got a guy. We got the one and only Mr. Doctor, Pastor Bishop. Every other name. Lee Moore, how you doing, sir?
See,
drinking the water.
Nice
Perfect timing. I used to wait tables.
How you doing, sir?
Thanks
Welcome.
For the intro. Really appreciate it. They have me on the show.
You are the mastermind behind Castle Rock Men's Health, and right up front, this is not some like paid interview or nothing like that. Like we literally, reached out and we legitimately asked the man to come in and give us some wisdom, some background, all that kind of stuff.
No,
so this is not medical advice.
Yeah.
All you knuckleheads out there, don't be coming up to him. You told me to. No, we talking about some good stuff today, man. And so we're so glad you're here. So excited that you're here, man. And how you feeling?
Man, I'm feeling really good. Just glad to be here and glad to get down into it. The topic of your podcast really hits deep for me.
Yeah.
It hits home.
Yeah.
Good.
On a lot of levels, personal, business, professional. So we can really go anywhere you want.
Good stuff.
Well, we'll definitely dig into it because I know we have our own questions and things, but I think those questions will also be a lot of other men's questions as well, especially considering what it is you do. And that was one of the things, how did you kind of get into what you're doing, and why did you found the Castle Rock Men's Clinic, and kind of what's the passion behind it?
You have a pretty eclectic. That's a big word. I went to public school, but I did.
You got the dictionary out again, didn't you?
Eclectic medical background. So share with us a little bit about your medical background, your history, your experience, all that kind of stuff.
Yeah, I think it's really important to really get into first and foremost, because it seems like today everybody's a doctor. I actually was doing some expert work on a case in Vegas where a physician's assistant, a PA, had gone and gotten their doctorate in physician assistant. So they're calling themselves, they're a doctor.
Oh.
And of course, physical therapists are now doctors, chiropractors are doctors. Somebody that has a PhD in biology is a doctor. And so nothing against further education or doctorhood, nothing against it at all. But I really think that's really worth getting out of the way. So I got a classic medical doctor, like who's that old dude back in the day with the beard and stuff?
The Surgeon General or whatever.
Yeah.
What's his name?
Like an MD, medical doctor.
Right.
So
for real doctor. Yeah. Like when we think doctor, that's what we think. Yeah. Medical doctor, white coat, stethoscope, can stick you with things.
We could all. The medicines of today are a bit of a questionable doctoring, but, so that could be argued if we wanted to go there. But anyway, did your class, the way this whole thing works is when you finish up high school, you go get a college degree, a 4-year degree, BA, Bachelor of Science. I did mine in zoology. Actually went and did a project chasing coral reef ecology in the Turks and Caicos Islands.
Well, that sounds like an awful,
It was
awful
really tough, man.
place to be.
I'm sure.
I'm telling you.
Did, swimming with the fish. And then after, because I did that, I was behind the curve on matriculating, which means getting into medical school. And so I came out to Colorado from Kentucky, and I worked at a ski resort and got 100 days in. I was like, I'm bound to come back here. So went back to Kentucky, did my medical work, 4-year medical degree at the University of Kentucky, at which time you're a medical doctor, but you know nothing. And then I was really moved and inspired by emergency medicine. I do have to admit that the show ER had just come out.
It had nothing to do with it, right?
Sexy. But I really was into the acute nature of things and, dealing with traumas and heart attacks and all that crazy stuff. It did that for a while, but seriously burned out, like almost immediately. So I finished up residency in Chicago, which was a 3-year program in 2001. Moved out to Vegas, worked at a trauma center there, moved here, burned out, decided to go open some urgent cares. Because the reality is I found out later I'm a bit of an entrepreneur at heart. And so open up a chain of urgent cares, physical therapy. I call them stores, but they're clinics. Sold those, got into some other stuff, blah, blah, blah. Fast forward to today, so let's talk about, my take on medicine. I don't think it would be much different from 95% of doctors. And that perspective is what we have nailed is if you break a bone, we do really good at putting that back together. If you're having a heart attack, we've really got that dialed. We can get that fixed. But when you look into the things that really matter to people, like if you look at what matters to your girlfriend, boyfriend, wife, what have you, it's they feel like shit, they're anxious, they're depressed, they feel stressed out, they're getting fat, and they don't know why. If you get to be my age, it's your performance in the sack is not what it once was. Your performance in the gym isn't what it once was. You start looking bald and old, and we don't have really good solutions for these things. Why don't we? I've got that answered as well, but I want to take this where you guys want to take it.
Yeah, no, well, that's the thing. Like you kind of hit one of the nails on the head with kind of the difference between the Western and Eastern medicine. Western being very good in trauma and triage, and if you break something, they put you back together. But they don't have. Seems like in my experience, and it seems like that you were kind of alluding to the same thing, that they don't really have a holistic mindset of let's look for the root cause and fix that, which is usually something like diet, exercise, something in the family stress. We can put you back together if you break something, but we may not be able to fix what caused all the other issues.
Now, here's the depressing answer to that. It's a great point. And here's why. It doesn't pay.
No.
We have a health system that is a for-profit health system that's making hand over fist money. And the way that health system is designed is that there has to be a complaint or a disease present to get paid. Our system is not set up at all whatsoever for prevention. You get any prevention specialist on this show, and I'll argue my point. And if they come on defending the current health system, I don't know where they're coming from. So that's really the issue. And that's why, because what we do at our clinic doesn't run through or filter through a health insurance program. Sorry, guys, it's cash only.
Yeah.
And that's where most of the doctors almost all the doctors that I go see, that's where how they're doing it.
Well, I know I do better by staying away from the doctors. For the most part, I stay out of the clinics and hospitals unless I just need to go in.
I don't have a defensible argument against that either.
Well, it's kind of the same old thing of, like the reticular activating system. You set your brain up to look for problems, it's going to find problems. So if I don't feel like I have a problem, don't go looking to somebody who's looking for problems. Because I even went and had a new prescription done for my eyes the other day, and she said, "Oh, your eyes have changed a lot in the last year or year and a half, whatever it was." She's like, "Is there diabetes in your family?" And I'm like, "Why are you scaring the crap out of me talking about diabetes when my eyes just like, no, it made me not happy with that doctor."
Yeah.
Well, there's a place or a position to have those types of conversations. And an eye doctor, I'll be honest with you, they get the first look at your microcirculation. And so they're quite effective at helping from a prevention level. But we can talk more about prevention and the skillful hormones if you want. I don't want to get off on an eye tangent.
Oh, we will. We'll kind of close out this segment and make sure we set that up for the next segment, because I know we have lots of questions. And I know one of the biggest questions is, as we get to our middle years, as we all are, how do we stay as healthy as possible? And I know a lot of the men's clinics are just about testosterone replacement therapy. And in my research, and I'll ask this of you, and then we can really dive into it later, but your synopsis answer of injections versus gels and creams.
Yeah. But that's probably more than a minute.
Okay.
And we gotta hit our break here. But I think this is really fascinating to get into a lot of these topics. A lot of these things, because to your point, a lot of it is, after the fact kind of medicine, I think, in our culture, but the before the fact kind of medicine, this is just my verbiage, I'm not sure if I'm saying it right, but I think a lot of the before the fact kind of medicine, to your point, gets a little bit left. And so a lot of these topics are just stuff that we don't normally talk about because, to your point, I mean, there's industries centered around the after the fact kind of let's fix some stuff instead of let's getting ahead of the curve and having less stuff to fix. So man, I'm really
if
excited.
we're healthy, they can't sell us anything.
That's a
no
huge
medication.
point,
they can't sell us anything.
So how about we go for a break, man?
Let's do this break, because we're gonna dig into this. This topic.
Mad Men and Masculinity, 12:20 a.m. in the Mile High City and on the interwebs everywhere. We'll be right back.
Oh yeah, we forgot to tell. We do like a 10-second break before we go in and after, so she can see the flat line, so she knows where to edit and stuff. And
speaking of edit, that's the first time she's gonna have to beep somebody.
Did I say a cuss word?
Yeah.
That's okay.
She was like, write that time mark down. Go back to that one. I bet you did.
Yeah, it came across so smooth, like normal talk.
Yeah.
I was like, oh wait.
What did I say?
Oh, you feel like shit?
Yeah. FCC doesn't like those type of words.
No.
Facebook and YouTube.
Oh yeah, they don't care.
Well, actually, that kind of get to the point where they edit a lot of stuff. They edit, you can't search certain words, and they'll.
We're all going to be on Rumble and Pinterest and all these other places.
Best if it's not out there.
Yeah.
But we all know what you meant.
Yeah.
And we're back.
We're back.
Mad Men and Masculinity on KLDC. We're in studio with Dr. Lee Moore.
That's right.
The Castle Rock Men's Clinic.
Health up in his house. Full disclosure. How I know this man. I was able to reach out directly to this man because I have been I don't know what you call him, patient client of your clinic. I mean, I love the service. I love what, the environment, the setting that you all offer and all that kind of stuff really gets me thinking ahead in terms of my health and all those kinds of things. And so I have a primary great office. I think you're expanding to the next floor up. I mean, man, on the blow up, on the come up in this bad boy.
Oh, so this isn't a paid advertisement for his clinic. This is you trying to get a discount. I see what's
Hey
going
man,
on.
I'm paying him to be here right now. I'm paying him. Matter of fact, what day of the month is it, man? I better check my account. It might be that time, man. Time for me to make another deposit in the Dr. Lee account. But so this is legit stuff. So okay, so how about we dive into maybe the shallow end? Why is let's just say hormone health? Why is hormone health important to, let's just say, men, since we are the home for healthy masculinity? Why is it hormone health important to men?
That's a great question. It's kind of the source. Well, of course, we can get into healthy eating, healthy exercising, healthy sleep, healthy spirituality. Those are all key factors. Here's the deal, guys. What we know from published science, I always say scores, meaning I think that's 24s of papers, because I don't know if there's hundreds, but we could easily say there's 100 of papers that tell us the following, and the sample size is hundreds of thousands of men. And here's what we know. What we know is that roughly 40% of men at 40 have low testosterone, roughly 50% of men at 50. That's half of every guy. I might say our age. I think I'm pretty close. We're all 40s, 50s guys. Yep. So it's roughly half of everybody that you're seeing. Now, we can unpeel this onion even more, because there's something even crazier going on that I want to talk about anecdotally that's now coming out in papers. But we're seeing low testosterone in very young men. Mm-hmm. I even have teenage clients. Mm. It's really freaking me out because I have young boys. Now, so what we know is that we have this slow decline in testosterone over the ages. And what you can see quite clearly in the population, if you look at the population, is as we get older, we see decline in performance. We see a increase in body fat index. We see a decrease in musculoskeletal muscle. We see a loss in stature or height. We see a decrease in brain performance. We see an increase in erectile dysfunction. So we can look at this almost commonsensically and say, watch this testosterone decline over time as we see all the stuff that we don't want to happen as aging men increase. That is why I would like to lead out and say hormone optimization is super important.
Yeah. Well, I mean, and all of those things that you're talking about are very important to most men. Plus, we're living longer. So we're not just, retiring at 65 and then just kicking the bucket at, 66. We're living into our 80s and 90s. And if it's half at 50 and we have half of our life to go, I mean, there should be some optimization because you want to have quality of life. And I know in my family, when my father passed, his whole thing was, as long as I have quality of life, I'll stick around. But as soon as my quality of life goes to whatever percentage, then I'm out of here. And I think that's probably true for a lot of us. We want to be as active and have the best quality of life as we can.
And I think, that's exactly where I was thinking as you were talking there, Doc, just in terms of there's the quantity of life. I want to live long. At this point, I've outlived my father and my grandfather, and the father both are in by 4 or 5 years so far. And just turned 50. And so there's that part of it. But then at the same time, besides quantity, I want to have quality of life. I want to enjoy the ride that I'm on, better as I plan to enjoy it longer.
Now, let's jump into quantity for a second, because we just talked quality, but I think we can make what a doctor would call an extrapolation on quantity. Now, here's another issue for which there are tens of papers and hundreds of thousands of patients that participated in the studies I'm about to tell you about. Now, what this says is that gentlemen that have a high testosterone level have a low propensity for the following: obesity, metabolic syndrome, diabetes, hypertension, heart attack.
Mm.
Now, gentlemen,
Can you say that again?
Yes. Gentlemen that have a high natural testosterone level have a low correlation or propensity for the following diseases: obesity, metabolic syndrome, diabetes, hypertension, heart attack.
All right, so you got an appointment open Friday? I mean,
no, but I got to finish.
I'm on the way.
I have to be honest. Now, we also find that gentlemen that have a low natural testosterone have a high propensity or predilection for those diseases. Where the data has not yet come in, it's starting to trickle, is if Dr. Moore takes you up to a normal natural, do we see that happening? I can tell you with over 2,000 patients is that, yes, we see it. We're correcting and reversing diabetes, obesity, metabolic syndrome, hypertension is resolving, on and on and on. But the paper's not out there. So I have to be honest, I just think it's happening.
well, and that's one of those, I mean, to your point before, I think there would be a lot of hesitation in the current medical dynamic to actually put those papers out, because now we're showing a way to fix a lot of these issues that doesn't involve a lot of their overpriced medications and prescriptions from the drug companies and stuff.
Yeah, I call it the medical industrial complex, and I borrow that from the military industrial complex because most people are familiar with that. And the reality is, testosterone cypionate's generic. They can't make money off it.
Yep.
They keep trying, of course. The big pharma. I had a recent guy I emailed called it the Pharmafia, but big pharma has tried to make an oral. It's called testosterone ondecanoate. The last time they tried, it gave guys liver cancer.
Of course.
So I'm like,
Of course.
let's stick with the
let's
cheap
not.
stuff that actually doesn't give you cancer.
Mm-hmm. I feel like, man, I mean, I'm really hoping this is not the last time you're on here. I mean, that we have.
You're gonna be a regular.
This
after
is like,
episode.
I mean, I'm thinking there's like a kabillion different like avenues to go down, and stuff to unpack that guys care about that guys don't talk about. And I mean, we like to talk about stuff that guys don't normally talk about. And ironically, which I hope to circle back at this maybe at the very end, but we also have a lot of women that listen to to our show as well, because a lot of guys don't talk about the stuff that we're talking about. So, but that being said, let's go to the base. I mean, when you talk about hormone optimization, what hormones are we trying to optimize, generally speaking?
Well, let's stick with men. We can unpack the women conversation whenever you'd like, because I had to learn women too. Because
We're all trying to learn women.
Yeah.
That's totally different. Never mind.
Yeah. So what ended up happening is I had men that would start feeling and looking great, and their wives, girlfriends, or family members wanted a piece of the action. And so I had to go learn them, because to be honest and get something bigger to unpack is that medical doctors dealing with women are afraid to do something that's on the edge. I'm not. I have a 25-year medical career. I should, knock on wood, never been sued. Only got taken to the Colorado Board of Licensure once.
That's pretty good.
And it was because a guy broke his foot, and I put him in a cast, and he went to his primary care, and his primary care said it's not broken, even though the radiologist and I both agreed it was. And he grieved me because I put a cast on him because his foot was broken. So I think I can wipe that one off. So anyway, back to what I was saying, I feel like I'm doing the right thing. I feel like I put people first. I feel like I come to the table with love for everybody, and so I'm not afraid to work with women medically, as most people don't. So I kind of got off on a tangent a little bit there, But
We
you
do it
wanted
all
me
the
to
time.
Unpack something on the men.
Yeah. What is the main
Well,
hormone kind of?
yeah, and
Yeah, thank you.
And I mean, we're talking like we're gonna obviously have to take a pause here in our break, but just really quick, like what hormones? That's what I want to get into just really quickly. Like, what hormones are we trying to optimize when we're talking about hormone optimization?
Yeah, we're in.
I don't know if that's a 2-minute answer.
No,
or
it's
not,
a
but-
2-minute answer.
Okay.
Men, we're talking about optimizing testosterone, and we're trying to keep their estrogen, which is estradiol, in check.
Mhm.
That's the main deal. In women, I'm playing with 3 balls that I'm juggling in the air: testosterone, progesterone, and the estrogens. So in men, it's testosterone and estrogen.
Okay. So it's just those two, right? Basically, just boosting testosterone and keeping estrogen down.
Yes.
That's all we really have to see.
There's
This is why
other-
women think we have it easier because they're, they got 3, we just got the 2.
Right.
And basically, we got the 1 because if we boost the 1, then the other one
Well,
usually goes down.
and
right?
so and some of these questions I'm asking, I kind of already know the answer because I'm, because dude, you got,
Got you fixed up.
But to your point, it is not just a one. It's not a seesaw. Like you are managing both independently. But I mean, when you talk about men, testosterone and estrogen, you're managing both of them independently, even though you're managing them kind of simultaneously, right?
Yeah, because men make when they get testosterone, we do what's called aromatization. We make estrogen in fat cells, and so if you can imagine the picture, I've got a guy with low testosterone with a lot of fat that comes in because he's low. I bump up his T and I got to block the heck out of his estrogen because he's fat. But now he feels great. He's pumping iron and he's losing weight. And so now I always got moving parts on both that I'm always managing.
Nice. Okay. See, I'm learning stuff. I like this.
Tell me,
We're
man.
getting down that rabbit hole. Speaking of rabbit holes, we better break this one off real quick. So we'll be right back. Mad Men and Masculinity on KLDC, 1220 AM in the Mile High City. Yeah, you're right. You're going to have to come back on.
Dude,
There's so many
right now, I'm
questions.
thinking,
I got so
there's
many questions.
Literally like a billion different avenues. We can have a whole conversation on this, a whole conversation on that.
It's true.
There's
Now,
too much.
when we'll do this on air too, but just from this behind the scenes stuff for you guys. Once you start, especially, is there like a boost scenario where you
Let's
can kind of
talk about
boost it,
that.
Yeah,
or do you have to like continue?
that's a viable,
Let's talk about
very
that.
viable question there.
We'll do that on air because everybody wants to know that.
Yeah, absolutely. All right, here we go. And we're back.
We're
Mad
back.
Men and Masculinity, KLDC, 1220 AM in the Mile High City and on the interwebs everywhere. If you're watching us live right now, because we record our weekend shows, we record them through the week, and so some people get the privilege, the opportunity, the blessing of watching us live as we record these things. And if you put in a comment in the chat or whatever, we'll see it, and JBK will make you famous.
Yeah,
And,
I know you guys are out there and you're always keeping silent.
Yeah.
You keeping stoic.
No, but,
Make comments. We're talking to you
we
today.
Can, we can ask
We got
questions. Be part of this whole
Dr.
thing.
Moore in the house.
And so
We're talking to you today.
And so, we take a little break here, and then during our break, we still jibber jabber. And if you watch us live, you can hear the jibber jabber. And so, if you were just watching us live, you heard a pretty a great question that JBK asked. That, man, I think it's critical to ask here live
Yeah,
on the public forum here.
Yeah, this is
so,
one
what's
of
the
the-
question, JBK?
This is one of the questions I had for my own self, and I'm sure I'm not the only one, but being at this age, needing to do testosterone replacement therapy or wanting to do it to have a higher quality of life and better health, is there a booster kind of scenario where you're just doing it just to get like your engine started to generate your own, or is it something where once you start taking it, your body stops making it, and then you are having to do it constantly?
Thanks for the question. So it's a deep dive, but let me start with first something I told you about before, which was we see a decrease in testosterone as a function of age. There's a couple of interesting things that I started to see that I'm actually working on, trying to get some higher level, maybe government funding to look into this. I started to notice that in men I was testing in their 70s and 80s, they had a really high testosterone. My dad's testosterone was 6 times mine.
Wow.
There's guys our age in the 40s and 50s that pay close attention to that decline I was talking about. But the problem is in our young men today, they are low. And it's scaring me. Now, I always have to concede that there might be a selection bias, meaning I'm only seeing the guys that feel terrible so they came and found me. But I have done some random studies and found these guys are low, and that's worrying me. And what that tells me is an environmental toxin or exposure. If y'all want to dive into that, we can. Now, back to your question. So when I've got a 16, 17, 18-year-old guy that is low, I must look into all possible avenues. Whereas a guy like us who's 40 or 50, I'm like, it's bro, this is as good as it's going to get. We're going to have to replace you. Now, let me unpack this a little more. A guy who's 40 or 50 who still wants children and wants to see, can I bump it up a little bit?
Mm-hmm.
Because if you get on testosterone shots, that's what you got. I've been on them for almost 10 years. My partner's been on them for 25. When you go there, if you ever stop, you're going to come back to where you are, and you're not going to like it because you're going to go from the we're going to take you from the physiology of a 50-year-old guy to the physiology of a 20-year-old guy, and then you're not going to want to quit.
Right.
So the answer to your question, based on your current testicular production, I can endogenously stimulate you.
Okay.
We call it the endogenous program. I can use compounding pharmaceuticals to try to elevate what you're making. I'll tell you, for me, it's a pain in the behind because it makes your estrogen go crazy. But if that's what you want, that's what I do for you. And it's the same price as the testosterone gig. Now, let me go back to the 16, 20-year-old guy. I highly recommend that if you want to play this optimization game, there are some things that we can do to increase your production, especially if you're young, you still want to have children, you still want to maintain your sperm production. We can do, for example, red light therapy, not a joke. I actually worked with a team. I used to work at the Army facility down in Fort Carson in Colorado Springs. And I had a colleague there that worked with a bunch of troopers, got their total testosterone up 100, 200 points with red light therapy. We could talk through that. There's some supplements out of Africa, Tongkat Ali, Noja agrestis, a pill form that you can take, get a slight increase. Heavy lifting, weight lifting like crazy will increase your total testosterone. Eating not what the cardiologist want. That's a whole nother conversation to unpack. I eat fat and meat and green stuff.
Yeah.
I don't eat the cardiac diet, and my cholesterol normalized. We can have that conversation if you guys can handle it.
Yeah. Well, that's one of those things. Like, I know Jordan Peterson, Dr. Jordan Peterson,
He's a meat diet.
He's all meat, and it fixed all of his issues.
All of it.
So, and that's one of the things. I mean, and we're gonna tangent for a second, then we'll come back. But you even mentioned it before, and it's like a lot of doctors, they come out of medical school to heal people, but they've taken no nutrition,
None.
and it's all about prescriptions. And then you got a lot of dietitians who know, they're trying to help people, but they have no medical expertise, and there's no combining of these two things, which seems ridiculous.
And there's a huge problem that we have with our current let's just call it ADA cardiac diet. I can give you so many examples, guys, but I got really into supplements. This is something that I really got into because here's another fact. Well, first of all, 80-90% of all humans are deficient in most of the major vitamins and minerals. But what makes that even worse is if you were to take a tomato from the 1940s and you compared that to a tomato from the 2020s, there is 10% nutritive value that's left, but yet the carbohydrate value is still there. And so there's, of course, everything's multifactorial, but if you look at the world getting fatter, getting more obese, getting more diabetic, The foods that we eat are terrible, and the recommendations that we're getting are terrible. By the way, the food pyramid that was designed by the Department of Agriculture.
So it
and by the
benefited
way,
them.
America makes corn, soy, wheat, and what are the main things on the bottom of the pyramid? It's the stuff they want to sell.
Mhm.
It's
Mhm.
rice,
Mhm.
it's wheat,
Mhm.
it's corn, it's carbohydrate. So back to how can you increase your natural testosterone level? Well, I can show you a chart of all the human hormones. They all emanate out of cholesterol.
That's good to know, because most people will go, well, let me go talk to my doctor, and then doctor's like, well, do this or do that, and then it gets worse. Now you got to put on this medication, then
That's
this
true.
medication to counteract that medication. Then you got the big 7-day pill jar thing where, like a lot of our parents and stuff, the older folks, they're taking pills like it's candy and Tic Tacs nowadays.
That's right. That's one pill to treat the side effects of the other pill.
So there's a holistic perspective that I'm going to say could be, but I think we probably all agree that we are missing out on in terms of how we look at our health and how we look at, how we look at our overall, just, the holistic health, but even the holistic physical health, like even the holistic physiological health, I guess you could say, in terms of how we look at our bodies and how we treat our bodies and grow our bodies and even just how we conceptualize taking care of our bodies.
Yeah. Well, even speaking of that, we had a question. Nikki asked, how do you know if a teen is needing help with that, meaning low T or low testosterone? What would be the signs? Speaking of, like, how can you even tell if they're low?
Well, it's man. Thanks so much for the question. First of all, second, man, unpack some B-roll footage from the 1940s and 50s.
Mm-hmm.
You look at boys in high school in the 40s, 50s, and 60s. They had a beard, big muscles, full hair, gigantic, and they were just kicking behind and taking names. And you look at you look at footage from prom today, and the women are taller than the boys. They look a bit emasculated. They're timid, and of course, there's not just physiologic issues. There's sociologic issues, etc. But I would say, I have real conversations with my boys, and you've got to start with real conversations, and their real conversations revolve around the same, what we call the Adams questionnaire, which is a questionnaire looking at androgens. And those questions are, do you feel grumpy? Are you getting at it? Do you have the muscle mass you want? Are you having deterioration in sports? Are you having deterioration in sex, etc.? Let me tell you what else drives testosterone down. And I think the picture starts to become even more clear. Masturbation decreases testosterone.
Dude.
Video games decreases testosterone.
Dude, I'm about to punch this daggone camera right now, man.
Not being out in the sun in nature decreases your testosterone level.
And how do our young men spend their time indoors,
Yes,
looking at a screen, just masturbating their whole youth away?
Yes,
I mean, and it's somewhat of a soapbox, but it's not. It's coming from a heart, not coming from judgment. But our young men are just masturbating their youth away to free and unlimited, porn on screen. But they spend their time indoors, looking at a screen all day and all night. And man, that's got to have mental, impacts. Obviously, you just said is that physical impacts, and I've been sitting here like chomping at the bit, like, man, I'm connecting dots in my head, and you just drew a straight Sharpie line from one to the other, man.
It hurts,
because
we love our youth and our young men. We love them deeply, but this pornography thing it is trash.
Dude.
And it is really physiologically kicking these gentlemen in the pants. I mean, I don't want to get too deep down the rabbit hole, but this is the dopamine response from a masturbation session is just as addicting as Adderall,
Mhm.
cocaine. It's terrible.
Dude,
It is.
I teach this stuff. I mean, what you don't know about me. I mean, yeah, that is my Superman from my Clark Kent. Like I wrote a book about it, and I mean I came out of a 30-year addiction to porn myself from 9 to 39, and that was before unlimited broadband internet. That was back when there was CDs at best, and so yeah, man. I mean that's a whole other tangent, dude. But I'm sitting there like, man, as you were talking, I'm connecting dots, and I'm just like, man, you got to be kidding.
Well, speaking
me,
of connecting dots, we
Let's
better
connect
do this break because
I'm about to break
we're
this
getting
camera.
we're getting this side eye over here.
Well, yes.
So we'll be right back, Mad Men and Masculinity on KLDC.
Yeah, I don't know if I would go as far as they had a porn addiction.
Yeah.
But I was so big into it, and it totally impacts your relationship with your wife. And when you just cut it out, man, the relationship with your wife goes freaking crazy.
Dude. Because we as guys, we forget that intimacy is not just sex.
Right?
You can have sex but never have intimacy, but what we're really craving is intimacy.
Yes.
And what they're craving is that manhood part of us that fills in their feminine space.
Yeah.
Well, this is all the things that we're talking about. I mean, I've been talking about the conspiracy of this war on men. I mean, that's why we're doing this show, and it started way back in probably the 50s and 60s. Where like we do not want healthy masculine men that want to protect their families and their nation. And so all of these things, the hormones in the chicken, all the drugs, now the video games and the pornography and all these different things are just taking away the manhood. And then, like you said, I mean, you look at 18-year-olds back in the 50s, they look like 30-year-olds today.
Yeah.
And the kids today, I mean, you almost can't tell the difference until they're almost 20
And
something.
generationally, consecutive last couple of generations of men, I mean, the whole overall testosterone levels of generations, as you said, like, even a while ago, is just going down from generation to generation. It's like the dulling of men.
Yep.
You take that blade and you just dull it, over and over again, and it's like, man, we're losing the sharpness. And then unfortunately, women are having to step into that place and become more masculine.
It makes them very unhappy.
Oh yeah.
Anyhow, man, I'm telling you, man,
There's so many. There's so many things.
Dude.
Yeah, we
didn't even know it was going to go this way. I mean, but man, this is. All right,
but it's the truth. It's the truth.
What's is this 3 or 4?
This is 4.
Oh, man, see, dude.
Is it?
All right, here we go.
I think it's 4. That third episode was that third one was long. We got so into it we forgot to.
No, we're good, man. We're good. All right, let's bring this thing. We're back. We back.
I'm hearing voices.
Like Superman's cape.
That's right.
We back like bell bottoms.
What?
Are bell bottoms back? We back. Mullets are back. I don't know who's bringing mullets back. One person that don't have to worry about a mullet is Dr. Lee Moore.
That's right.
Just saying.
He's keeping it smooth.
You know what I'm saying?
He's keeping it high speed,
like
no
butter.
drag.
Mm-hmm. For real. We're here talking about men's health, physical health, and we're specifically narrowed in on hormone health. And it turns out this conversation has been, talking about hormone optimization, all kinds of other stuff. And I mean, we have a legit expert in the house.
Yeah.
He has a clinical practice, Castle Rock Men's Health. That's kicking butt and taking names and changing the game.
Yeah, and he's one of us because we have rabbit holes that we've been trying to not put our feet in and go too deep in. But one of the things that we even discussed during the break, so if you listen to us on the radio on Saturday or on Wednesday, you might want to go back and check us out on YouTube because a lot of the stuff is good. So we're going to attempt to, in this last segment, kind of tie this up in a bow. But one of the rabbit holes we went down is why younger men are losing testosterone, why they have lower testosterone. And one of the things that is keeping us as men from being that tide that raises all the ships, that brings everybody up, because we're lacking that critical ingredient of manhood, which is high testosterone, which makes us stronger, more aggressive, more determined, happier and stuff. And so you touch on some of those things, Dr. Lee, and I don't know how to keep this concise, but let's touch on a little bit what is impacting our men today, our young men, and why is something we need to look into. Because I know in my experience, and I think because of my age, it didn't impact me quite as much because maybe of my generation, it didn't impact my testosterone as badly as it is the younger generation now of being indoors and being playing video games, not seeing the sun, the food, and all these different things. Because that's one of the things that came to my mind when you're talking about that. Men, boys are inside now, not seeing the sun, eating processed food, and not being outdoors and exercising.
I mean,
what do we do about it?
I mean, that's a great question. What do we do about that thing? I mean, that's a big question. That's a lot of weight to put on you, man.
A lot of weight.
I mean,
let me talk through some other points,
Yeah.
and then if we have more time, we could. It's out of my area of expertise because I'm not into sort of public health and I'm not a politician.
Right.
But aside from everything that you just said, what we know to be true, there is something called xenoestrogens. They're essentially trans estrogens, and what they are is, if you can think of any way that your body impacts petroleum products. So first of all, we breathe them in. Secondly, we're all touching a plastic table. Your phone is plastic. I'm drinking out of plastic
food
bottle.
containers.
Now, this food container sat in a truck that might have been 180 degrees, which will leach out the xenoestrogens from the plastic into the water. So despite whatever temperature the water is, you're drinking it, too bad. We also microwave a lot of food in plastics. Now, when you microwave foods with plastics, you're really leaching out xenoestrogens. And so what our problem is not only is this all pervasive, these xenoestrogens, but they get into our body, and A, we can't get them out, and B, they interact with the testosterone receptor. And even if you have normal testosterone, those xenoestrogens can block the receptor. So I have this in about 20% of my guys. I get their testosterone up to 1,000, and they're like, I don't feel anything. Wow. And I'm like, it's receptor blockade, bro. And they don't want to hear you've got to completely change your life around and start eating like the guy on the farm. So let me also dive into one last thing, and then we can talk about however you want to do it. Fertilizers. This is going to be huge. I did a lot of work in the military on guys that had been impacted by PCBs in all types of, let's just call them toxic agents. I'll tell you something crazy. The agent that's very similar to Agent Orange, it was actually taken by Monsanto and turned into fertilizer.
Of course.
They just flicked it around a little bit, and this is ubiquitous across the nation. And so so that's what I can cite literature and show you this is legit, but it's not mainstream legit. There's not another doctor that spent hundreds of hours looking at even like 60-year-old publications like I have to really unpack this weird phenomenon that's going on in the world. It really all comes back to medical industrial complex, military industrial complex, food industrial complex. I'm sure we're all of the same ilk, and these things aren't really out to help anybody. And so that when we talked, let me finalize this. Sorry, I'm stealing the mic. But what I initially talked about was there was a high testosterone young men that declined with age. And I told you I saw old men that were higher and young men that were lower. That points out to a generational exposure. And if you really think about it, guys my dad's age ate out of the garden when they were young. Guys my age were transitioning into this urban thing. These young guys, all they eat is crap. So that's what I got for you.
Man, I want to make sure at the end we have space to let people know how to plug into you and everything you got going on. I got like 2 hopefully quick answer questions that I'm sure some people would want to know. First of all, and I'll ask them both so you know right out of the gate, you can budget in your own mind. First of all, if someone is doing we've been calling it hormone optimization. Let's say, for example, if someone's doing testosterone therapy, what are the methods, the physical methods by which you do that at your practice? And then the second question is, where do women factor in terms of their hormone optimization? And do you have women coming in as clients and patients at your practice at Hal? So those are the two questions that I want to make sure we get in before we wrap up.
Oh, great. Thanks for the question. So they're really, okay, so let's take out the oral route because we told you that in the past it gave you guys liver cancer. All right, so number 2, possibility is a topical cream or gel. I don't do those. Here's why. We have an abnormal absorption, A, I don't know how much is getting in, and B, when you put it onto your skin, you have it on your hands and your skin, you give it to your kids, you give it to your wife, you jump into the swimming pool, you give it to everyone else. We call that a lateral transmission. I don't want any of that happening. And B, I've tested people on topicals and their levels could go from 50 to 500, and I know what they are. There's this other thing called pellet therapy. I need more time to talk about that. I don't do that either. It doesn't give you a good consistent absorption rate. So drum roll, unfortunately, the only way I'll do it is subcutaneous or intramuscular injections once or twice a week.
Well, and that's what I've heard is that those are the only ones that actually work. And so
it works.
I've seen all these other products. There's lots of multi-level marketing out there now with this gel and that gel or this thing and that thing. But when you do the research, even if you read anything that has any kind of reviews, it seems like the injection is the only way to go.
So do people have to come to your clinic to get those, or
We can mail them nationwide. Yeah, we do telehealth calls with the nurses, and they teach people how to inject. The nice thing is the subcutaneous needle is less than a half-inch long, so it's really hard to do a lot of damage with that needle, especially.
And you do labs to make sure you keep track of the levels of whoever it is you treat.
Absolutely, we have to get initials, let's say 7-8 week labs, to make sure that we hit our target, and then we generally do every 3 to 4 months until both of us are so bored with the results. We're like, can we go to every 6 months? But that hasn't happened for a while.
Right. Okay. And then that last question was women.
Yeah, women are. That might take some more time to unpack. Let me just tell you briefly. If a woman is, let's say, 30 to 45, 50, and she's feeling low energy, can't put on muscle, too much fat, no sex drive, we definitely need to check her testosterone. In fact, all of them. There is something else that we haven't talked about that's a bigger deal, and that is when I told you about the guys like my dad that have a high normal testosterone level, they still have a problem because as you get older, you make more binding proteins, so it traps the testosterone, and the testosterone can't get intracellular to do work. Well, guess what? Women, as they get older, they get more of that. And there's another epidemic that I'm seeing, and that is women that have been using synthetic progestins, i.e. birth control pills, when they were younger. Now their hormones are completely whacked out, and these gynecologists don't know what to do, don't care, or they're caught up in the medical insurance complex and they can't do anything about it. And so we have women suffering. But moving on, women that are perimenopausal, we start to focus a little more on the progesterone part. And then postmenopausal women need the full, what we call premium complement of the testosterones, the estrogens, and the progesterones. But because we're short on time, I just need to etc. They're coming from the synthetics, women. They're coming from the synthetics, and you probably don't even know this, but the estrogen they used to give you guys was made from horse pee. I don't think I can say piss.
I don't know.
Made from horse pee.
Sure.
It's the way it is.
I mean, you guys are always getting the short end of the stick. So yeah, a little more expensive with those bioidenticals, but I must.
And last but certainly not least, man, first of all, we got this ain't the last.
No,
This is
you'll be back.
Yeah, you be back. But how do people get a hold of you in your clinic?
Oh, thanks for asking. I mean, we have a website, which is www.castlerockmenshealth.com. And of course, the front desk is 720-524-8949. And we got trained specialists who'd be happy to talk to you.
Gotcha. And even though it's Castle Rock Men's Health, you can do a lot through the mail.
Oh,
So it's not
Hawaii to New York to Florida to Texas.
Not like folks gotta, drive to your office and all that kind of stuff.
No.
Good stuff, man. This is ridiculous, dude. Like seriously, this is tip of the iceberg.
Tip of the iceberg.
We didn't even scratch the surface of all this kind of stuff.
Yeah, there's so many ways to go, and
No doubt.
it's so necessary, and it's one of those things where, gentlemen, we're here to help you level up. We're here to help you be better men. And when you're in your middle years like we are, and you're only halfway there, it's time to start looking at, okay, what do I need to do to not just increase the quantity, but the quality of life? And some of those things are going to be that physical health and that mental acuity, which a lot of that comes from your hormones. So you got to see my man over here.
Yeah.
Give him a call, because we all want to have better lives, better quality lives, and make sure that quantity is good.
And holler at your boys, madmenradio.com. Support local radio people. Shout out Crawford Broadcasting. We appreciate y'all. We love the Mad Men Mafia, Mad Men Mob. We dig all of y'all, man. And we're trying to help you level up, because when you level up, we all level up. So with that, Mad Men
out.